Welcome to this recorded webinar presented by the Washington Healthcare Authority's Independent Assessor. The intent of this webinar is to provide information about the midpoint assessment process for the Medicaid Transformation Project. My name is Catherine Snyder, and I am with Myers & Stauffer, the firm contracted as the Independent Assessor. Our agenda for this presentation is to discuss the purpose and objectives of the midpoint assessment, why it is occurring, who will be involved, what the outcomes are expected to be. We will review the high-level process of the midpoint assessment, share the timeline that will be followed, and describe the approach to receive public comments to gain additional perspectives regarding assessment findings. Throughout the presentation, you may see midpoint assessment abbreviated and referred to as MPA. Before discussing the MPA further, we will first outline the larger context in which the midpoint assessment is being conducted. The Medicaid Transformation Project is an agreement between the Washington State Healthcare Authority and the Centers for Medicare and Medicaid Services to demonstrate improved health outcomes and effective use of resources. This is a demonstration waiver that authorizes up to $1.5 billion in federal investments with 3 initiatives described in the waiver. Initiative 1 is known as Transformation Through Accountable Communities of Health, or ACHs. This initiative drives improvements through health system changes at the local level. There are 2 other aims, referred to as Initiatives 2 and 3, respectively, that seek to address improvements in long-term services and supports and community support services. The midpoint assessment relates to Initiative 1. This slide includes common terms that are mentioned throughout the presentation and can be used as a quick reference. ACHs play a critical role in Initiative 1. Initiative 1 supports accountable communities of health, which are self-governing organizational models with multiple community representatives focused on improving health and transforming care delivery for the populations that live within their region. ACHs coordinate the implementation of regional projects and support distribution of incentive payments when defined milestones are achieved. As I have described, the Medicaid Transformation Project is a waiver with multiple aims. Initiative 1 focuses on implementing these regional projects. In brief, the responsibilities of the Independent Assessor begin in 2017 with review of the ACH project plans. Our role also includes reviewing semi-annual reports submitted by the ACHs, as well as conducting this midpoint assessment. These activities are required as part of the agreement between HCA and CMS. Myers & Stauffer is a certified public accounting and consulting firm with extensive experience with demonstration waivers, and in particular, delivery system reform waivers that serve to transform the healthcare system. Uniquely, our firm only contracts with state and federal healthcare agencies to ensure that conflicts of interest do not arise with service providers. We have no affiliation with the ACHs and maintain impartiality as we complete all tasks. I've spoken about the agreement between the Healthcare Authority and CMS. This agreement is codified through special terms and conditions that specify requirements for HCA to follow. The STCs require that the midpoint assessment systematically identify recommendations for improvements to ACHs and implementation of project plans. It is important to note that ACHs are required to participate and act on recommendations that emerge. Such recommendations could be in the form of ACH administrative processes or responsibilities, such as communication methods, training, or other support offered to partnering providers. Incentive funds could be withheld if action is not taken. Separately, the requirements further specify that an independent external evaluation take place that evaluates the metrics and progress of all 3 initiatives. A different contractor will perform this evaluation. There may be overlap to our methods, but our roles are different. Let's begin to look at the MPA. This process flow indicates the steps that will be taken by our team and may be used as a quick reference. We mentioned that this will be a review that is fair and impartial. It's based on the goals of Initiative 1. Our independent assessor team will conduct interviews and review materials to understand the status of implementation progress, and there will be an opportunity to submit public comment. Our team will provide constructive feedback to HCA and ACHs when applicable, and our team will provide recommendations related to project plans. Our team will follow these guiding principles as we conduct this work. We will remain fair and impartial as required by our independent status. We will confirm compliance with the expectations outlined in the authorities of the waiver. We will seek to verify and document the progress that has been made to implement projects compared to the milestones that were set. If gaps are found, we will develop recommendations for course correction when sufficient context is available to make such recommendations. Importantly, this midpoint process allows our team to capture and commend successes and highlight promising practices that may be replicated throughout the state. This will be a more in-depth review process than the semi-annual review process. A product of this will be to reinforce the sense of shared responsibility across ACHs and partners to attain the goals of the waiver. The midpoint assessment is an opportunity to promote the progress that has been made and ensure ACHs have the support required to meet the project goals for high-value care. This inverse triangle frames each aspect of our process and draws us from purpose to result. The objective defines the goals of the MPA. Areas of focus identifies the related STCs and protocol requirements that we'll be comparing against. The review elements defines the system levels that we will be reviewing. The components defines the review areas that support MTP attainment. And the review procedures describes the actions that our team will take. The source requirements summarizes the materials and documentation that will be reviewed to support the MPA procedure. And lastly, the recommendations. These describes the results of the MPA based on the waiver and IA contract. There are two objectives that guide our work. The first objective is to demonstrate compliance with the approved protocols and STCs, and second, assess the health of projects. On this slide, we identify the areas of focus that we will be comparing compliance against. Our review will assess ACH management and project plan execution through 3 review components. These are project implementation, ACH organization, governance, and compliance, and lastly, the distribution of earned incentive funds. To assess the health of projects, Objective 2 reviews 2 systems levels, the ACH level and local health initiative efforts. Review components include such topics as training and assistance, population health management through data exchange and usage, and community-based care coordination, to name just a few. These components represent the levers for transformation achievement. Consistent with Objective 1, we have written review procedures that we will follow, and we have identified in advance the types of materials to be reviewed. This allows us to remain objective and fair when comparing progress across regions and as we develop a statewide aggregate picture. An example of source documents that we will request to assess local health initiative efforts includes the applicable partnering provider change plan, MOU, or other agreement with the partnering provider that describes which projects, responsibilities, and tasks the provider has agreed to implement. Critical to developing an understanding of the health of projects across the state is gathering broad and varied perspectives. HCA recognizes that many stakeholders are participating in the waiver in different capacities. Some providers may be engaged directly with implementing project activities, while other partners may be acting as affiliates who are offering input as community representatives. All perspectives are important, and we will gather as many as possible, including those identified on this slide. Our mode of review will also take this level of variation into consideration as we complete our assessment. We will be utilizing site visits, conference calls, focus groups, and desk reviews so that we balance gathering feedback against stakeholder or staff inconvenience. One final method that we will utilize to gather stakeholder input will be to offer a public comment period once findings are gathered. The ACHs will receive initial findings by November 29th, and then these findings will be published to the HCA webpage by December 6th. A public comment webinar will be held on December 9th so that individuals can either ask questions or offer comments. Comments will be able to be collected throughout this period through December 13th. This process will be fully explained when the comment period begins. This timeline identifies all key dates to be aware of throughout the NPA process. First, please be aware that we will conduct procedures and interviews through September and October. We have targeted to submit the initial findings to HCA by November 1st. We will then follow the public comment period as described in the prior slide. We will then submit a final report to HCA by December 20th, to the ACHs by the end of December, and then advise and collaborate with HCA and ACHs on any identified challenges starting in January of 2020. If you have any questions about this timeline or midpoint assessment process, please submit them directly to our team. The email address is wadistrip@mslc.com. This concludes our presentation. Thank you for participating in this review of the midpoint assessment process.